50% of couples who are trying for their first baby will be successful within 6 months, and about 85% within a year. Most of the time we'll suggest that couples will seek help at about the year mark. If they're trying for a second pregnancy, their success rates are higher, to where 50% are successful within 6 months, and 50% within 3 months, and 85% within 6 months. So those people need to come in earlier. Other reasons to think about coming in earlier would be a history of irregular menstrual cycles, because missing and skipping periods would make a difference in terms of your likelihood of maturing and releasing eggs consistently. Age is a factor as well. Women who are over the age of 30 and certainly over the age of 35 are probably worth seeking help earlier. And men who've had a history of trauma or infection to their testes, because that may affect sperm production and motility, should probably seek help earlier. The most common problem that we find is failing to mature and release eggs consistently on the part of women. Unfortunately, this is one of the most fixable problems that's out there. There are medicines that we have that can help the brain drive the ovary to produce eggs on a consistent basis, taken cycle by cycle. One of the next most common is some abnormality with sperm numbers or motility or sperm quality. Unfortunately, we have urologists in our area who are interested in caring for patients with these kinds of problems. Sometimes it's problems with the pelvic organs themselves, and indeed we have ultrasound evaluations and surgical and non-surgical approaches for managing these kinds of problems, including hysteroscopy and laparoscopy, to look for things such as fibroid tumors, endometrial polyps, and endometriosis, where implants along the pelvic surface can interrupt and interfere with pregnancy and conception. In fact, most couples do not need in vitro fertilization. In a practice such as ours, a fairly thorough workup and evaluation can be begun to identify delay problems and evaluate and achieve a plan so as to make a success of pregnancy. If in vitro fertilization is indeed needed, we have a good relationship with the reproductive endocrinology specialists in our area if we need a referral in that regard. There's a small number of couples that even after a thorough evaluation, there's no clear reason for their fertility delay. Those people ultimately do end up at in vitro fertilization often, but interestingly, their long-term success rate is about 50% at 6 years, even if they have no active therapy at all.